Students, welcome back. Now we are going to see the contents which are passing and also related to the superior as well as the posterior mediastinum. So up to the bifurcation of the trachea, we can divide it. Okay, we can divide this thing as superior mediastinum, and this one is the inferior mediastinum. And but the parts of this trachea, principal bronchi and the azygos vein is present in the medial mediastinum, and the remaining part of the azygos vein and the aorta is present in the posterior mediastinum. Again we will see the contents. So this one is the esophagus, and coming to the descending thoracic artery and its branches are related to the posterior mediastinum, and also the vein, that is the azygos vein on the right side and hemiazygos vein and the accessory azygos vein. So this hemiazygos vein and the accessory azygos vein, these are present more posteriorly, which finally terminate into the azygos vein. So this will be present posterior to the descending thoracic aorta. Okay, and then nerves. The nerves are the vagus nerve. Here the vagus nerve. So both sides, right side and the left side vagus, or also passes on in the posterior mediastinum, and also the splanchnic nerves, which are arising from the lower 8th thoracic ganglion of the sympathetic chain, which are seen on the posterior aspect, still posterior, near the on either side of the vertebral bodies. And coming to the lymph nodes, posterior mediastinal lymph nodes lying along the side of the aorta. Along the side of the aorta, you can see this mediastinal lymph nodes. Here you can see the thoracic duct. So this one, the thoracic duct, is also related to them, or also present as a content in the posterior mediastinum. So these are the contents of posterior mediastinum. Coming to the surgical importance of this posterior mediastinum. So I have already mentioned, in the case of superior mediastinum, we'll have some fascia, that is the pretracheal fascia and the prevertebral fascia. So these form some spaces in the neck. So, and some of the infections of these areas may spread to the superior mediastinum as well as the anterior mediastinum. Okay, so now we will see in the posterior mediastinum. This posterior mediastinum is continuous with the is continuous through the superior mediastinum with the neck. So from the neck to the posterior mediastinum, this neck and the posterior mediastinum is connected through the superior mediastinum. Okay, that means it is present in between the pretracheal and prevertebral layers of the cervical fascia. Okay, and these two regions of the neck, in between them it includes the retropharyngeal spaces. So it is a space present inside this neck. We will see in detail in head and neck regions, and retropharyngeal space, and spaces on each side of the trachea, and spaces on each side of the esophagus, and also space present in between trachea and the esophagus, and spaces between these tubes, and the carotid sheaths. So this carotid sheaths is a fibrous connective tissue which surrounds the carotid vessels in the neck. Okay, so infection from these spaces, whatever I have told, these spaces are present in the neck. Okay, or present in the neck. So the infections from these spaces can spread to the superior mediastinum, from the superior mediastinum to the posterior mediastinum. So this is of surgical importance. And compression of mediastinal structures, any mediastinal structures by any growth or like a tumor gives rise to a group of symptoms known as mediastinal symptoms, or called as mediastinal syndrome. Mediastinal syndrome. The common symptoms are obstruction of the superior vena cava, obstruction of the superior vena cava gives rise to engorgement of veins in the upper half of the body. So because of this obstruction of the superior vena cava, so the veins got blocked there in the upper half of the body, and pressure over the trachea causes dyspnea and cough. Pressure over the trachea causes dyspnea and a difficulty in breathing, so and causes cough. And pressure on the esophagus causes dysphagia. Difficulty in swallowing is dysphagia. So all these are caused due to some growth inside the mediastinum. So some growth or accumulation of any fluids causes some compression over all these structures, causes such kind of symptoms. Pressure on the trachea causes dyspnea and cough, and pressure on the esophagus causes dysphagia. Dyspnea means difficulty in breathing, dysphagia difficulty in swallowing. And pressure on the left recurrent laryngeal nerve gives rise to hoarseness of the voice. Gongur and pressure on the phrenic nerve. So pressure on the phrenic nerve causes paralysis to the diaphragm. On that side, which side phrenic nerve is affected, that side of diaphragm is getting paralyzed. And pressure on the intercostal nerves. So pressure on the intercostal nerves, we know this intercostal nerves gives rise to pain in the area supplied by them, so which is causing neuralgia. And also pressure on the vertebral column may cause erosion of the vertebral bodies. So these are the group of symptoms of mediastinal syndrome. The common causes of mediastinal syndrome are bronchogenic carcinoma, and some disease called Hodgkin's disease, causing enlargement of the lymph nodes, mediastinal lymph nodes. Okay, and also aneurysm, that means over dilatation of the aorta. So these are the causes for mediastinal syndrome. Okay, this is about the surgical importance of posterior mediastinum. By knowing all these things, the surgeon can easily find where actually this carcinoma or any tumor is present. By knowing this knowledge of posterior mediastinum, it is easy to remove such kind of tumors and relieves the symptoms. Okay, so this is about the mediastinum. In the next session we are going to start pericardium and heart. Thank you.